Thanks to everybody who's joined the webinar this afternoon. This is Exercise Your Mind, Collaborating to Enhance Physical Education in Illinois Schools. Please note that this session will be recorded and will be available on IPHI's website, and CPDU credits will only be available for participants in today's live web conference. Before we get started, I wanted to do a little bit of housekeeping. Organizers will mute all phones during the presentation. You will be unmuted during the question and answer session at the end of the webinar. At that time, we'll take live questions, and you can use the raise hand option on the control panel on the right-hand side of the screen. You can also ask questions anytime during the webinar via the chat function on the bottom right of the control panel. You can see in the control panel, the image on the screen in front of you, that the small orange arrow can be used to maximize or minimize the control panel. There's also the raise hand option at the bottom of the side panel for the control panel. There are also materials available in the control panel. The CPDU evaluation forms and everything that you need to complete those is available there, as well as a copy of the Illinois Enhanced PE Strategic Plan, and you can submit questions at the bottom of the control panel. In partnership with the Healthy Schools Campaign and the Illinois State Board of Education, 1.5 CPDU recertification credits are available for attendance at this webinar. Attendance will be verified through our host for the webinar, and records will be maintained. The standard evaluation and evidence of completion forms will be provided to participants who complete the activity. In order to receive the CPDUs, you must participate in the duration of the webinar, complete the required forms, and submit the forms to IPHI via email or fax. Again, the name of today's webinar is Exercise Your Mind, Collaborating to Enhance Physical Education in Illinois Schools. This webinar is hosted by the Illinois Public Health Institute in collaboration with the Illinois Enhanced PE Task Force and the Healthy and Active Communities Network. Today we'll hear opening remarks from Superintendent Christopher A. Cook as well as Dr. Teresa Garate, and then we'll hear presentations from Dale Brown and Paul Zintarski. At this time, I'm going to review some of the biographical information for the presenters and encourage you to look at their full bios available on IPHI's website. Dr. Christopher Cook was appointed as the State Superintendent of Education in December 2006, and he's been with the Illinois State Board of Education since 1994. He's served in a variety of administrative capacities, including Director of Special Education and the state's Chief Education Officer. As State Superintendent, Dr. Cook has been a strong proponent of using data to inform policy, and is working with the P20 longitudinal data system where student achievement can be linked to post-secondary education and careers. He supports the establishment of nationally and internationally benchmarked standards that promote both rigor and relevance, as well as assessments common to all states so that fair and accurate comparisons about student performance between states and countries can be made. Dr. Teresa Garate will also provide opening remarks. She's been the Assistant Director of the Illinois Department of Public Health since 2010. Prior to joining IDPH, she was a senior level administrator in the Chicago Public Schools, serving as the Chief of Staff for the Office of Specialized Services during Arne Duncan's administration. Before her work with CPS, Dr. Garate served as the Center Director of the Department of Disability and Human Development at the University of Illinois at Chicago. After the opening remarks by Drs. Cook and Garate, our first presenter will be Dale Brown. Dr. Brown is a professor in the Department of Kinesiology and Recreation and is director of the Illinois State University Exercise Physiology Laboratory. With 24 years of professional experience, he has taught in both the undergraduate and graduate programs at Illinois State University, teaching a variety of classes from human anatomy and physiology, exercise physiology, exercise in health and disease, statistics, and other courses. Followed by Dr. Brown will be Paul Zintarski, who is the Learning Readiness PE Coordinator for Naperville School District 203 in Naperville, Illinois, where he spent the last 26 years as Department Chairman for PE, Health and Driver's Education at Naperville High School. Paul retired in May 2010 after 40 years in education. Through Learning Readiness PE, Naperville Central High School has seen dramatic improvements in test scores, behavior, and childhood obesity, which we look forward to hearing about on today's webinar. After Paul Zintarski has provided his presentation, we will wrap up with some more comments from Dale Brown. To start with, I'd like to review the learning objectives, which are to describe Illinois' Enhanced Physical Education Strategic Plan and the state-level commitment to quality physical education, explain how PE has been redefined to optimize health and academic outcomes, understand the association between physical activity and academic performance, and identify meaningful ways to support quality PE and potential resources for working with schools and communities to increase opportunities for physical education. Dr. Cook, I'd now like to hand the mic over to you to provide your opening remarks.
Thank you very much, and it's my pleasure to kick off this webinar by providing a bit of background on the Illinois Enhanced Physical Education Task Force and the recently released strategic plan. The Illinois Enhanced PE Strategic Plan was released this summer and provides a high-level roadmap for implementing the vision that all Illinois K-12 students will participate in daily, high-quality physical education. A voluntary, multi-sector task force helped develop the vision and strategies captured by this strategic plan, which has been a year in the making. This task force is co-chaired by the Illinois State Board of Education and the Illinois Department of Public Health and convened by the Illinois Public Health Institute. It was first convened in early 2011 and was charged with informing development of a plan that could be used to make rapid and significant progress towards implementing enhanced PE programs in Illinois schools. The task force adopted a vision and mission and brainstormed and refined goals and strategies. The strategic plan is a call to action. It highlights the critical role of local school boards, superintendents, and principals in enhancing PE and key opportunities for them to provide leadership. The plan is also designed to engage key community stakeholders and inform them of the need for and benefits arising from an enhanced physical education curriculum and increased physical activity and wellness in schools. The overarching strategies outlined in the plan fall into four general categories: educating and promoting leadership on enhanced physical education among school district and school officials, developing and utilizing metrics to assess the impact of enhanced physical education, promoting training and professional development in enhanced physical education for teachers and other school and community stakeholders, finally identifying and seeking local, national resources to support enhanced education. The plan serves to support key partners in making a commitment to and taking steps towards the implementation of evidence-based PE strategies in the long run. In late June, the Illinois legislature passed Senate Bill 3374, and the governor is anticipated to sign it into law very soon. This bill will transition the Enhanced PE Task Force from a voluntary group to a statutory convened task force. It will be charged with promoting and implementing enhanced physical education programs that can be integrated with a broader wellness strategy and health curriculum in elementary and secondary schools through strategies that align with the strategic plan. The statutory task force will also make recommendations on the revision of Illinois' PE curriculum standards based on the growing body of neuroscience research connecting physical activity with improved learning. During today's webinar, Professor Dale Brown of Illinois State University will provide historical perspective on how PE has repeatedly redefined over the past century and provides a clear picture of what quality PE looks like by today's standards. Then Paul Zintarski, an educator for over 40 years, will explain how enhanced PE correlates directly to the health and well-being of students and has cognitive benefits, making students more receptive to learning. He will review some highlights of the significant body of research showing that children who are more physically active perform better in class and on standardized tests. Professor Brown will then conclude the webinar with some information on what's being done at the national, state, and local level to support quality PE and some thoughts on potential next steps. Improving opportunities for physical activity is an imperative for improving our children's academic achievement and their health. As educators, we shouldn't have to choose between teaching students how to read and teaching them the skills to live a healthy life. We can do both and improve our children's educational outcomes. I'd now like to turn over to my co-chair for the Enhanced PE Task Force, Dr. Teresa Garati, who will provide some more depth on the research supporting Enhanced PE as an evidence-based practice. I know that Dr. Garati will be handing off the co-chair to Dr. Hasbrook effective September 1, 2012. Thank you.
Thank you, Dr. Cook. And thank you for having me on the webinar, Kobe. So I'll start with a few thoughts. The Illinois Department of Public Health looks for every opportunity to support the implementation of evidence-based public health practices like Enhanced PE, which is one reason that we are so pleased to be co-chairing the Enhanced PE Task Force with Illinois State Board of Education. Decision makers in health departments, communities, schools, NGOs, and at all levels of government are in a constant struggle to figure out what works to achieve their goals. Public health practitioners, much like educators, pride themselves on evaluating their work and building an evidence base that provides guidance for future decision making. The Community Guide. In public health, we look to the recommendations in the Guide to Community Preventive Services to find evidence-based practices. This community guide is a free resource designed to help communities identify health improvement interventions that are evidence-based and proven to work. It identifies programs, services, and policies proven effective in a variety of real-world settings, such as communities, work sites, and schools. The recommendations in the Community Guide are made by an independent, non-federal volunteer task force appointed by the Director of the Centers for Disease Control and Prevention. This task force was established in 1996 by the U.S. Department of Health and Human Services to provide evidence-based recommendations about community preventive services, programs, and policies that are effective in saving lives, increasing longevity, and improving America's quality of life. Policymakers, practitioners, and other decision makers use the Community Guide's findings and recommendations to help them make informed decisions about allocating scarce resources to effective programs, services, and policies across a broad range of healthy priority areas. Based on a systemic and comprehensive review of all available evidence, the Community Guide recommends enhancing physical education programs in order to increase the amount of time students spend doing moderate or vigorous activity in their PE classes. Currently, students enrolled in traditional PE classes fail to meet the Healthy People 2010 goal of spending at least 50% of class time being moderate to vigorously physically active. In fact, some estimates place the actual activity time of PE class at about 37% of the total class time. This would mean that in a traditional 30-minute class period, students would spend only 11 minutes actually engaged in physical activity. Let me say that again. This would mean that in a traditional 30-minute class, students would spend only 11 minutes actually engaged in physical activity. This is substantially lower than the recommendation from the U.S. Department of Health and Human Services that youth engage in 60 minutes of physical activity every day. Enhanced PE consists of making classes longer or having students more active during existing classes in order to increase the amount of time students spend doing moderate or vigorous activity in class. There are various ways to enhance PE. One strategy for enhancing PE is to change the activities taught to increase physical exertion of the students and minimize their inactivity, such as by substituting soccer for softball. Another strategy for enhancing PE is to modify the structure of traditional activities to ensure active participation by all students. For instance, if students are playing softball, then the teacher can have all students in a PE class run the bases when a batter gets a hit. Additionally, enhanced PE programs can emphasize a more general approach to health education that builds skills and knowledge needed for lifelong physical activity and nutrition. As we make progress in enhancing PE, it is equally important to integrate adaptive PE standards for students with physical and developmental disabilities. Research has shown that enhanced PE programs can increase the amount of time students spend engaged in physical activity at school, increase daily energy expenditure, improve overall aerobic capacity of students, and have a significant impact on physical fitness. Moreover, enhanced PE teaches students about activities that can help them become active for a lifetime, which has the potential not only to prevent childhood obesity, but to prevent adult onset obesity as well. Illinois is the only state in the nation that has a daily K-12 PE requirement. This mandate is implemented in different ways at local schools and school districts, where decisions about PE curricula, resource allocation, and scheduling are made. Some schools have sought and received waivers for the state-directed mandate, but those waivers are limited in scope and duration. Even schools that have waivers may be searching for ways to enhance their more limited programs offerings. In addition, a number of school districts in Illinois will soon be reaching the end of their waiver periods and may be ripe for new PE curriculum, such as Catch or Walk Across Illinois, or for adopting new PE standards like those in the Healthier U.S. School Challenge. We Choose Health. In addition to all of the work of the Enhanced PE Task Force, the Illinois Department of Public Health is also involved in additional work around this area. This month, the Illinois Department of Public Health announced the award of 21 grants totaling $3.5 million to Illinois communities, many of whom have been funded to implement the coordinated school health model in their local school districts. As many of you know, the coordinated school health model brings together school administrators, teachers, other staff, students, family, and community members to assess health needs, set priorities, and plan, implement, and evaluate school health activities. The coordinated school health model consists of 8 components, including physical education. We encourage you to look at our website on We Choose Health, www.wechoosehealth.illinois.gov, to find out who has been funded through the We Choose Health initiative and to collaborating with those grantees and other community partners. The We Choose Health initiative is a key initiative of the Illinois Department of Public Health in which we are going to try to impact obesity, chronic disease prevention by promoting healthy eating and active living. With the release of the Enhanced PE Strategic Plan and the current efforts to promote Enhanced PE and improve the PE learning standards, the state of Illinois has demonstrated its leadership on this issue. Dr. Cook and I are pleased to welcome today's speakers who will discuss the value of enhancing PE and what can be done in the classroom, in schools, and in communities all over our state to make quality PE a reality. Thank you.
Thank you very much, Dr. Garate and Dr. Cook. Your leadership has been very important with the Enhanced PE Task Force here in Illinois, and we appreciate you providing opening remarks for today's webinar. As I mentioned previously, our first presenter will be Dale Brown. Because I've already read the bios, I won't read those again. I'd like to go ahead and hand the mic over to Dale. Dale, can you go ahead? If you're speaking, we can't hear you. I apologize for this technical issue.
How are we doing?
There we go. We can hear you now. Yep.
You got me?
Sure.
Okay.
Go ahead.
Hello everyone, and thank you, Kobe, for the opportunity to be here today. As we get started, I think first Paul and I would like to take a quick moment to thank the organizers and the support for this webinar and for the opportunity to participate and present for you today. We hope you find the material that we're going to present useful and beneficial as we all work to move physical education forward to improve the health and well-being of our children. We also would like to take a moment just to especially thank Colby for all her work that she's done on this and the effort that she's put together in coordinating and organizing this webinar. To better understand you, the participants, we would like you to take a quick moment here and try to get a feel for who you are that are out there and indicate your profession or role by responding to this quick poll. So if you would, please select on your screen what best represents you, and we'll just take a quick moment for that. I know we're coming off of lunch here, so hopefully you're all ready to activate your keyboard and you're not nodding off after that nice lunch meal on a beautiful Friday afternoon.
Great. We've got about 89%, 90% voted, so I'm going to go ahead and close the poll and share the results.
Good. Very nice mix of individuals here, so we appreciate your participation and attendance here today. Physical education has had a long-standing tradition in American society. Its purpose and function has changed across time, with its initial roots being founded in hygiene and body care, and as you can see on the timeline presented on the screen. As collegiate sports grew in America, intramural programming became an integral part of physical education. Eventually, the concerns about military preparedness, national defense gave rise to JFK's President's Council on Youth Fitness with the development of the physical education curriculum for American youth. Physical education has subsequently evolved into a sports skill model and a game approach, which tends to be the current focus of many programs in the United States today. However, we know that that is changing. The movement now tends to be on the new PE or quality PE, where the focus is on wellness, fitness, lifelong activity, and the prevention of disease. Phil Lawler, in addition to his longtime colleague and the co-presenter on this webinar, Paul Zintarski, are the founding fathers in the new PE movement. As indicated, and as you can see on the screen in an interview with Phil, if it were not for physical education, failing based on the old approach in the United States, there would be no need for the new PE. I direct your attention to the bottom of the screen. If you can see that, there's a link down there on sparkinglife.org where you can see that full interview, and it provides a very nice perspective as to Phil and Paul's approach to framing new PE. In terms of defining the new PE looks different than old PE, and the focus is different. Old PE tended to be focused on sports skills, learning games, didn't require retraining of teachers. The grading tended to be more subjective, and oftentimes the opponent in those cases were the other team, and it was generally more of a team approach. The new PE is not focused on sports skill development as much, but rather focuses on physiological factors associated with prolonged youth and vitality, disease prevention, health-based, wellness-based programming. Oftentimes the factors and numbers that are important in new PE are those such as individuals' lean body mass, their heart rate values, strength values, body fat percentage, their aerobic capacity, insulin sensitivity, cholesterol profiles, HDL ratios, bone density, and other important parameters are also measured. In developing and justifying the new PE, Phil Lawler stressed in an interview the disconnect between school funding priorities and student health and fitness. Specifically in that interview, Phil stated that schools are not funded or evaluated if kids are healthy, and that's a major roadblock. There's no pressure on administrators to make decisions based on health of the child. Given the current disease trends and patterns, this needs to change, and this is where the new PE is rooted. In defining the new PE, it's not just about recess, it's not just about activity, it's not just about obesity prevention and treatment. It's about understanding intensity and duration of activity. It's understanding moderate to vigorous physical activity. It's understanding and trying to get children to understand the components of fitness. It's rooted in student assessment, with data being collected and letting the data drive decisions and making changes in curricular offerings and funding approaches. It's about wellness, lifelong fitness. It's important in understanding lifestyle disease prevention and certainly academic achievement. In defining the new PE, a word of caution as we start to describe and talk about the new PE. We find often that some teachers and programs may be offended with the use of terms like old PE or use of terms like new PE or quality PE. Since standards are often loosely defined and left to interpretation as to what is actually taught in physical education, some may say they're implementing and addressing state standards within the old PE, so why the need for this quote-unquote new PE? So be prepared as you work with various schools, school districts, teachers for various reactions and various responses. When looking at the new PE, various professional organizations such as the National Association for Sport and Physical Education and governmental agencies such as the Department of Health and Human Services have worked to define new PE on quality PE and help determine guidelines, goals, objectives, and recommendations for physical education programs to follow in PE program modification and development. The big focus today in physical education programming is targeting moderate to vigorous physical activity. So PE doesn't just mean moving and having people moving around in an activity type pattern in a class, but it's a real focus on moderate to vigorous physical activity. So as you can see on the table on the screen, there are two columns there, one that describes and defines moderate intensity activity, and moderate intensity activity typically is defined as requiring a moderate amount of effort and noticeably accelerates the individual's heart rate. Examples of moderate intensity activity: brisk walking, dancing, housework, domestic chores, and the like. Vigorous activity, as shown on the right side of the screen, requires a large amount of effort and causes rapid breathing and a substantial increase in heart rate, such as running, walking uphill, fast cycling, aerobics, and the like. Probably the easiest and best way to monitor moderate to vigorous physical activity is with heart rate monitoring. Heart rate monitoring allows for accurate assessment of individual effort and an assessment of the physiological responses to the activity. So the graph that you see on the screen here is showing a variety of activities that kids engage in physical education classes. In this situation, we were out at a school and we tested 534 kids, sophomores, juniors, and seniors, while they were engaged in various activities in physical education, from golf on the left, volleyball, eclipse ball, to way over on the right where you see cross-country running. The y-axis shows then what the average heart rate response was for those various activities. So you can see relatively quickly what those average values are. Activities then can be classified as whether they're meeting the cardiovascular conditioning requirements as set forth by various professional organizations, such as the American College of Sports Medicine. So what's added on this graph then at the top of the graph in the shaded area is what's typically considered to be the cardiovascular training zone of a 60 to 90% intensity of heart rate based on an age-predicted maximal value. And you quickly see as you look at the graph, there are certain activities then off to the left of the graph that don't meet that requirement, whereas there are certainly a number of those on the right side that do. So heart rate gives a way of classifying activity as to whether we're being effective in those activities. Activities can also be easily evaluated as their quality as related to academic enhancement or academic achievement. Similarly then, when we look at what the research is showing to indicate what the heart rate is, the intensity of the activity needs to be for improving academic performance, it's been shown to be about 160 to 190 beats a minute. So as you look at this graph, when we look at that standard up at the top part where we're in that 160 to 180 range, we can see that, for the most part, most of the activities in this most of the activities that kids are engaged in in these physical education classes are not meeting the requirement for academic performance enhancement. Regrouping these activities another way based on common curricular offerings within school physical education programs. One can quickly see that individual sports, indicated by the two bars or two columns on the left side of the graph, with the red bar indicating heart rates for boys, yellow indicating the heart rate for girls. We can see, in addition to that, team sports, the middle two columns, and again your red and yellow indicating boys and girls respectively, that both individual sport and team sport classifications have significantly lower exercise heart rate responses in comparison to the heart rate responses observed in what are typically classified as more fitness-based activities in PE offerings. It should be noted and pointed out that the individual and team sport activities presented here are based on the traditional sport model for physical education, such as 5-on-5 activities, 9-on-9, 10-on-10, or dividing the class into two sides and people get involved in that activity, which is different than the restructured approaches that were talked about in the introductory remarks and what Paul will talk about when he speaks of activities that are based on more 3-on-3 or small group approaches and more of a focus on targeted heart rate. Oftentimes when one hears or participates in discussions regarding the new PE, it seems that much of the focus is centered on body weight and obesity. But there's more to the new PE's role than that of weight control and obesity prevention and treatment. Many of us are aware of the relationship of body mass index and disease process, as can be seen on the graph here with the x-axis showing body mass index values, and on the y-axis then showing our mortality ratio and various diseases that are related to body mass index. It's not just the case that too much weight is of concern, but also too low of weight can also be of concern. And so the figure here with the J-shaped or somewhat U-shaped pattern indicates that there's an optimal body mass index for individuals in terms of preventing various types of diseases. Just to make sure you're all still out there and active, we have another poll question for you at this point in time, and we're curious to know what you feel is has the strongest association with good health in youth and adolescence. Is it body weight? Is it body composition, i.e. body fatness? Is it body mass index? Or is it physical fitness? And we'll give you a moment to respond to that.
We've got about 56%. I'm going to wait until we get closer to 80%. 73%. All right, we've got 84%. I'm closing the poll.
You guys must have been listening too well to the opening remarks. Physical fitness seems to be the key. Very good. While the body weight, body mass index disease relationship is well established and important, it appears that it's the fitness of the individual rather than the fatness that's important. Although regular physical activity contributes to the reduction of fatness and adiposity, many beneficial health benefits from physical activity are independent from from its effects on adiposity. Moreover, a number of studies suggest that physical activity may actually counterbalance the hazardous effects of increased fatness and adiposity. While it is true that overweight and obese individuals are at greater risk, there are definitely benefits to exercise and activity. This graph here shows, as you look at the x-axis, body mass index subdivided out into quartiles, with the lowest quartile on the left in grouping number 1, the next quartile number 2, the next highest quartile number 3, and the next highest or the fourth quartile then number 4, as related then to the y-axis, which is the incidence of non-insulin dependent diabetes mellitus or type 2 diabetes. And clearly evident off of the figure that as body mass index goes up, so does the incidence of type 2 diabetes. Key on this, though, I want you to focus in on is that for each of those groupings, there's a blue bar and there's a red bar. The red bar indicates individuals who engage in vigorous exercise on a regular basis versus the blue bar individuals who did not engage in regular exercise. And you can clearly see the beneficial effects of exercise by significant reductions in the incidence of diabetes, even in the presence of fatness or a high body mass index. So physical fitness, exercise, and activity are extremely important. Similar results have been shown with regard to fitness and academic performance. Again, it's not the fatness, it's the fitness that seems to be the key. So this graph, while looking a little busy here, clearly shows the relationship between a number of components of fitness, body composition, cardiovascular fitness, and the like, as related to performance and one's ability to do well on standardized testing. So this is a project that was conducted with looking at middle school students and the relationship between fitness and their ability to perform on the Illinois Standard Achievement Test, with the blue bars indicating their scores on reading, red column indicating the math scores, and then the orange indicating the response or their ability to perform on the science part of that test. 838 kids were tested, and we can clearly see then on the responses associated with the various fitness parameters. The y-axis shows the odds of meeting the ISAT standards, so it gives an indication of relationship between fitness and academic performance. The two variables on the left show the relationship between BMI and academic achievement, and then the next bar or set of bars shows percent body fat. When you talk odds ratios, we want to be greater than 1 to have a significant relationship. In this study, we see that there's basically no relationship between BMI and body fat percentage and one's ability to do better on reading, math, and science ISAT test scores. In contrast, when you go to the pacer laps, and for those that are not familiar with it, the pacer laps are a way that we assess cardiovascular fitness in a child. And clearly evident here, as you look at the graph, those that have higher cardiovascular fitness values, kids who have higher cardiovascular fitness values, were 2.5 to almost 3 times more likely to do well on ISAT testing, specifically with the math and reading. And we see similar results with curl-ups with almost a 2 to 2.5 times or increase in academic success relative to that component of fitness with the curl-ups or sit-up type test. And you can see also for push-ups not as much of a relationship, nor was there as much of a relationship on the far right with our flexibility scores. But clearly, it becomes evident, again, it's about the fitness of the child and not just the obesity or the BMI values. And with that, we switch to Paul and the topics and areas that he will be covering at this point.
Thank you so much, Dale. Appreciate the thorough orientation to this topic and some of the research that you've been involved in that you shared with us. At this time, we will hand the mic over, as Dale said, to Paul Zintarski. Paul, go ahead.
Thank you, Kobe. Thank you, Dale, for the interesting information you provided us. I want to say the same kinds of things about my gratitude for participating in this particular webinar as we go forward. So I want to spend some time talking about the current research that shows that exercise promotes the growth of new brain cells. Therefore, it's enhanced PE that will improve academic performance in schools, not necessarily spending more time sitting in seats. And I hope to show you evidence that shows that enhanced PE improves disciplinary outcomes and attendance as well. And so since test scores seem to be the driving influence in school districts, enhanced PE is essential on several levels. This particular graph is a study done in the state of California in 2004. And in the state of California, they have to give their fitness tests in grades 5, 7, and 9. And so they thought that they would put in their reading and math scores in line with their fitness scores. So the bottom line on this graph indicates the number of tests a student is healthy in using the fitness gram. And their scores then are on the left-hand side. So as you see, as students become fit in more tests, academically their scores go up. And again, you're looking at grades 5, 7, and 9, which they have to report out in California. This particular graph indicates English language arts. The next graph that's coming up indicates mathematics, and it's the same thing. The beautiful thing about this particular study, it's the state of California, and so it doesn't take into account socioeconomic backgrounds or gender. All students who were given the tests and the fitness tests were on this scale. So we see again that as you become fit in more areas academically, your scores go up. Got this out of the University of West Virginia in Wood County. They looked at 725 fifth graders and followed them 2 years later when they were in 7th grade. And so they had their fitness scores and their test scores at both levels. And again, they used that standardized test score. And what the study found is that academic performance dipped when the students' fitness declined from 5th grade to 7th grade. It increased, however, when students improved fitness-wise, so their scores went up. And the students with the highest average standardized test score, which included reading, math, science, and social studies, were deemed fit at the start of the study and at the end of the study. In 2009, Dr. Ken Cooper, who created the fitnessgram in Texas, raised enough money to test 2.47 million students in the state of Texas. And again, he wanted to see which tests were most telling for academic success. Cardiovascular fitness was certainly number one, and he thought body composition was number 2. And so the next slide will show you if the students that are in the exemplary category using the gray bars in their statewide testing, you see that cardiovascularly, 80% of those students were in the fit category. As you move from exemplary to recognized, you see less of them are in the healthy category. Move to acceptable, again you see that the cardiovascular fitness level goes down. And once again, when you move to unacceptable in the test scores, again, cardiovascular conditioning goes down. So again, we're looking at 2.47 million students in the state of Texas. Now, people always want to know when I talk about this if there's any scientific data that, or anything that's in science that can prove it. I got this particular slide out of the University of Illinois, Dr. Chuck Hillman. And so you're looking at the correlation between fitness and brain activity. On the left-hand side, you're looking at a composite of about 20 6th grade student brains. So on the higher fit category, left-hand side, where the brains are lit up red and white, that's them sitting down resolving the issues of taking the test. The next 20 students on the right-hand side are lower fit, and they're sitting down taking the same test. And you see more blue, more cool. The brain isn't nearly as active. It isn't as fired up as the students who are more fit. More importantly, as you move down to taking a hard test, you're seeing the higher fit students where their brains are practically all lit up, resolving the issues from the test. However, those students who are less fit can't even recruit enough brain power to do well on the tests. So in 2004, this gentleman, Dr. John Rady, came to visit our program in Naperville, and he started me on this journey of understanding neuroscience and brain chemistry. And his famous quote is that exercise like fertilizers to the brain is so good it's like Miracle-Gro. And the first thing he talked to me about was BDNF, brain-derived neurotrophic factor. And they discovered this in rats that exercise as opposed to rats that just problem solve. They found significantly more brain cells in rats that exercised than in rats that did problem solving, like solving the issues of moving through a maze. That's what led neuroscientists to say that it is truly BDNF or exercise that creates brain cells. So now you're looking at a slide of a brain cell with a nucleus and axons and dendrites coming off of it with all kinds of electrical charges leaving the nucleus. And in this next slide, we'll see that in the bottom left-hand screen you have your brain cells. So you have your your nucleus in the center, and off of it you have your axons and your dendrites. Up above, you see that the axons and dendrites do not touch each other. There's a gap in between them, and that gap is what we call the brain synapses. So the messages have to transfer from one brain cell to the next brain cell through that brain synapses. On the right-hand side, what controls those signals going from one brain cell to the other are neurotransmitters, chemicals that are formed in the brain, especially through exercise. And if it makes a connection right there, that's fine. If not, it continues to float around through the hundreds of billions of brain cells in our head until it finds a match and makes that match. So this next slide we'll be talking about those neurotransmitters. Every time you do an exercise, especially an aerobic exercise, you get an explosion of these three chemicals in your brain. The first of which is dopamine, and that helps us with reward, pleasure, motivation, and drive. That's that opiate that people talk about. To the right of that, we're looking at serotonin, and that helps us deal with obsessions, compulsions, and memory, things that we have to be concerned about with our students in school. If we move to the left-hand circle, we're talking about norepinephrine, and that helps us deal with alertness, concentration, and energy. Now, these three chemicals don't sit in our brains in isolation. They have a tendency to mix. So when you mix dopamine and serotonin, it helps us deal with appetite, sex, and aggression. The best way I explain this is generally after a really hard workout, you're not hungry. You know, you're thirsty, and about an hour or two later after a good hard workout, the calorie burn sits in, but initially you're not hungry. When we take the combination of serotonin and norepinephrine together, it helps us deal with anxiety, impulse, and irritability. And in the pharmaceutical world, that's Prozac and Xanax. And if we exercise properly, we don't need those particular pharmaceuticals in our life. More importantly, when you mix dopamine and norepinephrine together, it affects attention. In the pharmaceutical world, that is Adderall and Ritalin. And once again, our students don't need it as long as they exercise properly. Lack of exercise is causing all of this attention on ADD and ADHD. When you put all three of those chemicals together, you affect mood and cognitive function. So we know this about the benefits of physical activity. On the left-hand side, it helps us with attention and concentration, self-esteem, creativity, perception of academic or intellectual competency, or that self-concept, perceived self-complex, impulse control, life satisfaction, visual spatial skills, working memory. Academic behavior is also effective because it takes into effect conduct and on-time task work, not fidgeting around. Attendance is effective because if kids feel good about it, they will come to school. And then we know that academic test scores and grade point averages go up with the benefits of physical activity. If we could take the benefits of physical activity and put it in a pill, we'd all be rich. So here's a study done through an organization called PE for Life. We went to an inner city Kansas City school, went from 1 day a week PE to 5 days a week PE, and we improved fitness scores. But what that school also found out in that time is they had a 51% drop in disciplinary incidents involving violence and a 60% drop in disciplinary incidents in out-of-school suspension days. And that's dollars and cents. That's actual days in school that kids are spending there. So again, from 1 day a week PE to 5 days a week PE at an inner city school in Kansas City. This is an inner city school in Leavenworth, Kansas. And in 2004, they went from 1 day a week PE to 5 days a week PE. You see that they revamped their lunch program. They added vitamins to the daily menu. The three changes that they noticed, they had a 1,300% increase in those passing the presidential fitness test. More importantly, they went from 10th in their district in reading. There's only 10 elementary schools in that district. 10th in their reading and 9th in math to number 2 in reading and number 1 in math. And you see that their office referrals for discipline were reduced from 438 down to 18. So that's the benefit of enhanced PE. So again, a big takeaway moment again comes from Dr. Chuck Hillman at the University of Illinois. And you're looking at a composite of 20 sixth grade brains. On the left-hand side, those students are sitting down taking a test, but prior to taking that test, they sat quietly. And again, where the brain is lit up, that's the brain resolving the issues of the test. On the right-hand side, it's the same 20 students, not whether they're fit or not fit, same 20 students taking the same test after a 20-minute walk. And on the right, and those students then taking the same test scored on average 10% higher. Imagine that brain, what it would look like after an enhanced PE program where vigorous to moderate to vigorous movement was involved in the class. And so now we're looking at brain slides of obese adults, and we're looking at brain erosions, and we're now starting to see this is true in students that have type 2 diabetes. This is why enhanced PE is so important. We have to resolve these issues. So we created a Learning Readiness PE class in our particular school, and the course content and the sequencing is important. We put students in a PE class prior to a class that they struggled in. And the hope was to elevate their heart rates through cardiovascular workouts. Because this group had always struggled in school, teamwork was important. Tumbling and gymnastics is really key because it's important to get kids up in different positions, get them in, spinning and turning, and anytime you can cross the midline of your body, it helps prepare the brain for learning. All of our games, even soccer, are 4-on-4, 3-on-3 to make sure that everybody is involved. Even when we play volleyball, we'll play it in the same space with cones, divide the court in half, and we'll use 3 against 3 with 2 balls in the same space. Then it was important for the PE teachers and the academic teachers to coordinate their programs. So we performed this particular study on those freshmen coming in that were performing below grade level in either reading or mathematics. All students had PE, but we found out that an hour or two, or preceding math or reading, an hour or two before with a PE class really helped. And this next slide will indicate that even more. So on the 2005 year, we had a total of 16 kids involved in the program. It was a volunteer program. We had 0-hour PE, and the students who volunteered to come in before school are shown in the light blue. And you see that in a reading class, they improved almost 1.4, or a year and a half in a semester, as opposed to those students who improved the year. So we knew that the reading class was doing its job, but the PE class enhanced the learning even more. In 2006, then, we created what we call then Learning Readiness PE. We held it first hour. There were 2 sections. Now we involved 32 kids. 16 of those kids went to academic reading second hour. 16 of them went to academic reading 8th hour. And again, you see that those students who had PE just before their academic reading class had far superior results. In 2007, because people said, well, the afternoon kids started to shut down, we instituted 2 Learning Readiness PE classes, 1 in the morning, 1 in the afternoon, and follow those up with reading classes. And again, you see it didn't matter if it was morning or afternoon. It only showed that it preceded class. 2009, we gave the students an option whether they wanted to be in the LRPE class or not. And again, you see once again that the kids who opted for the LRPE class just before the academic reading class had greater improvement. 2011 showed the same kind of results, only the difference why the results are so higher, this is overall over a year. So we're looking at almost 3 years growth in a year in academic reading on a nationwide test. This is on a nationwide test that those students had in 2011. We involved mathematics in the second year of the study. So we had a first hour Learning Readiness PE class. We created a third hour math class. Again, it was divided in half with special ed and regular ed. Half of special ed and half of regular ed were put in PE, LRPE. The other half had PE afterwards. Again, you see that those who had regular PE afterwards didn't do nearly as well. Almost a 21% increase on those students who preceded that math class with LRPE. 2007, 2 sections of LRPE. We included more students. We're up to now 48 students in the study, so you'd expect numbers to drop a little bit when you add more numbers. But again, we almost doubled the improvement. 2008, every student who had what we call then our algebra ready class, or it was pre-algebra, all were put into an LRPE class, and again you see their performance. 2009, the year the kids had the option, we had greater, again, results with those kids who preceded that class with LRPE. We added another intervention in 2009, which is why the growth in the non-PE is so high. So what does this LRPE look like? Well, it's based on cardiovascular fitness intensity. We expect our kids to get their heart rates up between 145 and 200 beats per minute. We do that every other day. Cross-lateral movement is very, very important. Core strength. Dale talked about sit-ups. Core strength, since the brain stem is connected to the spine, core strength is important. Team building, as I mentioned earlier, is important. Balance and gymnastics is important. The traditional team sports are all small-sided, so it really encourages kids to be involved and have to be active in our maintaining vigorous to moderate movement all the time in our team sports class. So in our department, the emphasis is on fitness, wellness, and health and team building, and we certainly don't spend our time worrying about sports skills. Enough organizations do that. I believe a good physical education program looks something like this. At the bottom, early elementary, body management, body control, body awareness, and posture are important, but physical fitness is the base there. Same thing as you move up, fundamental motor skills, locomotor skills, rhythm, object control, bats and balls. Again, physical fitness is the base. When you move up into junior high, we're talking about the combination skills, lead-up games, sports, those types of things. One more time, physical fitness is the basis. At high school, lifetime skills, sports, and leisure are important. But one more time, physical fitness is the basis at that level as well. Thank you. I'll turn it back over to Dale now.
Excellent. Thank you so much, Paul. It's great to hear some of the research around the neuroscience related to physical education, as well as how important it is to time physical education strategically during the day, as well as physical activity during the day. At this point, we will hand it back over to Dale.
So the remaining portion of our webinar here today, we'll be talking about what's being done nationally, give you some ideas of some programs and initiatives that are taking place, also statewide and also locally. So what's being done on the national level, and looking at national leadership, I guess one could say that the support is coming from the top all the way down. Support for physical education continues to come from all levels, from presidents to the First Lady. The Alliance for a Healthier Generation works to address one of the nation's leading public health threats, and that's childhood obesity. The goal of the Alliance is to reduce the prevalence of childhood obesity by 2015 and to empower kids nationwide to make healthy lifestyle choices. The Healthier U.S. School Challenge is a voluntary certification initiative established in 2004 to help recognize those schools participating in the National School Lunch Program that have created healthier school environments through promotion of nutrition and physical activity. Hopefully we're all aware, in February 2010, First Lady Michelle Obama introduced the Let's Move initiative. Let's Move is a comprehensive initiative dedicated to solving the challenge of childhood obesity within a generation so that children born today will grow up healthier and be able to pursue their dreams. Let's Move incorporates the Healthier U.S. School Challenge into their campaign to raise a healthier generation of kids. What's being done on the state level, statewide leadership, state leaders and organizations also realize the importance of physical education. As previously mentioned, the Illinois General Assembly passed State Bill 3374, which amends the school code and establishes the Physical Development and Health Task Force. Pat Quinn's interest in trying to get kids in schools active with Walk Across Illinois program also shows that state leadership. State support and buy-in is important because we need leadership from principals, superintendents, school boards to really make our schools healthier. When local school leadership has support and encouragement from state leaders, then they're empowered to be change leaders at the local level. Some examples of what's being done locally: leadership from schools and school policy change. An example here, Danville Public School Wellness Policy, where they adopted and implemented their guidelines for physical education, where all students in grades K through 12 will receive daily physical education, or its equivalent of 150 minutes per week for elementary students, 225 minutes per week for middle and high school students for the entire school year. All physical education will be taught by certified physical education teachers. Student involvement in other activities involving physical activity will not be substituted for meeting the physical education requirement. Students will spend at least 50% of their physical education class time participating in moderate to vigorous physical activity, and then optional physical education classes will be offered to students in grades 11 through 12. Other examples of this, we've worked with an area middle school principals, so it's not just changes that are being implemented with respect to PE classes, but also schools in general. Worked with an area middle school principal that felt that her staff was becoming overweight, inactive, and unhealthy. So she included within her school wellness policy guidelines and recommendations to get her staff moving. Her message was simple: teachers need to be role models. What's being done from a technological aspect, as most of us are aware with the explosion and changes that are taking place in something as simple as a cell phone, we see the same thing happening in physical education classes with new technology, with heart rate monitors, activity monitors, pedometers, accelerometers are all ways and devices that teachers and schools can use to provide an objective means of evaluation within physical education. The latest technology, working with a company called Polar, who's been very active in school physical education and heart rate monitoring, with the development recently of the capability of entire class exercise heart rate monitoring all at one time with real-time data and the capability of email and reports home immediately when the session's done to parents and children, or to use that information to be incorporated in students' fitness wellness portfolios. You can see in the picture up on the top right a class, an activity going on with individuals. Kobe, if you go back just one slide there for a moment. Look at individuals exercising with heart rate monitors on, and then on the back behind the gentleman that's leading the group you can see what's being projected, and that's the picture on the forefront of your slide here, with each individual student showing what their heart rate is in the small number in an individual's upper right-hand box there, and then also the percentage of their max at what they're working at. And then for each individual, you can see the color-coded boxes, number 1, 2, 3, 4, 5. So quickly you can get an idea of kids and whether they're working in their the target heart rate zones in the moderate to vigorous physical activity level. So some very impressive technology that's currently available. Sorry, I caught you off guard there, Kobe. So the value of monitoring, we have a model that we work off of: data drives decisions, and that needs to be incorporated into physical education. While this figure here is rather busy, what it's trying to show is that with heart rate monitoring, through heart rate monitoring, we can almost do a day-to-day log, if a teacher wants to do that, of what kids are doing, how they're responding physiologically within a physical education class. So if you can see on the screen on the left, it shows the date for the different activities, shows what the activity is, whether it's a mile run, whether it's heart rate basketball, inline skating, cardio circuit. More importantly, or equally important off of that then, there's numbers there showing you what their target or their heart rate values are. More importantly, as you look off over to the right, you have the graph with the yellow, green, and red lines. For each of those activities, we can get an indication as to whether a child is in their target heart rate zone, they're below their target heart rate zone, or if their heart rate is above their target heart rate zone. And this is again provides great objective data that allows for teachers to incorporate that into their grading scheme, or in terms of justifying physical education to administration, parents, or whatever the case might be. Also, what's being done is student awareness and education. We're finding that there are curricular changes being implemented with the focus on new PE, which helps to bring quality enhanced physical education programs to students in hopes of preparing them for healthy lifestyles. A couple of pictures for you here just to kind of reinforce the idea of relatively simple things that can be done that enhance physical education. The picture on the left shows a high school student wearing a 15-pound fat vest, demonstrating what we at the university see and typically have referred to or associated with the freshman year as the freshman 15. And so the purpose of that fat vest is we had a student wear that, and they wore it for an entire class, and they got a chance to see and feel what 15 additional pounds was like on their body as they wore that all day. Lesson off of this day's activity was relatively simple. Calories in, calories out, affects weight gain, weight loss, and it's important to be cognizant of that. The picture on the right shows students using pedometers. You can see their pedometers attached to their hip, and we use those to get students to understand and connect the idea of movement and energy expenditure and calorie expenditure. And as simple as it sounds, it was a relatively simple experiment we did. We had kids wear the pedometers, walk from the front of the building to the closest parking spot in the parking lot of the school 10 times. We then had them walk from the front door to the farthest parking spot 10 times, opened up their pedometers and asked which burned more calories. And while this may seem like I'm making it up, it's true. One of the students looked at the pedometers, and when the lesson was done, he said, "So you mean if I park in the farthest parking spot, I will burn more calories and expend more calories than if I park closely?" So kind of an eye-opening experience for us, thinking that that's pretty common knowledge, but kids need to be made aware and have to have an educational component so they understand what the purpose of what's trying to be accomplished in physical education. Additionally, what's being done is professional development, teacher retraining. We look at physical education and want physical education to change, but oftentimes teachers aren't trained in what's being done with and called for with new PE, so the teacher retraining is important. And so we've been hosting teacher retraining and technology camps. This past summer, Illinois State University hosted its 8th annual Summer Polar Technology PE Teacher Camp, which is one of 2 locations in the United States that host such camps. Prior to Paul's retirement up in Naperville, he also hosted and coordinated similar technology camps for teachers. Paul has also been actively involved in the development and promotion of PE for Life and the DuPage County Institute. In addition, there are other professional organizations and professional development opportunities for teachers in state organizations such as IAFRD and other national organizations. Additionally, what's being done, the establishment of partnerships, and I think you're clearly aware of that today by participating in this webinar. The We Choose Healthy initiative that was mentioned earlier includes several state agencies, local organizations, health providers, schools, businesses, and other community groups. The We Choose Health initiative provides funding to local coalitions to implement their programs to assist in a wide variety of health needs and health outcomes within communities. Other local partnerships with hospitals and professional organizations such as the American Heart Association help to allow for screenings for cholesterol, blood pressure, diabetes, etc. These partnerships have been invaluable since oftentimes PE teachers have not been trained with the understanding of implementing health, wellness, and preventative disease-based models. So partnerships are very much needed. So as we look at what PE can be, the new PE or quality PE requires an investment. Investment in leadership, time, money, training, equipment, facilities are all very much needed. It doesn't require high-dollar approaches, but it requires more than a $200 a year ball budget, which oftentimes in schools is what we're finding PE programs trying to deal with, if even having $200, sometimes less than that. But it also requires the resolve and the will to want to make a difference. Simple changes can be effective, whether it's a $10, $15 pedometer, or if you're going into looking at $200 heart rate monitors. You don't have to jump to the high-end toys and trinkets. There can be a progression there. Recently, as we've spoke about already, legislative changes have made it so 90% of the states now require high school PE. Illinois requires daily PE for K through 12 students. Yet with all that we know, there are barriers that still are present. Recommendations can be made for PE, but that doesn't mean it's being implemented. And so again, that's where we all come into play on this to make sure that we're putting the pressure in and trying to request and have quality physical education be installed in schools. Waivers and exemptions still exist. And a recent article, and you can see the reference on the bottom of this slide that I recommend you all read, that was just published a couple months ago, talks about why quality PE is not being implemented, and there's various reasons that were cited in that, from greater emphasis on standardized testing and test scores, that schools are required to increase their test scores in quote-unquote the academic areas, which means cuts are made to physical education. Ironically, though, as you saw Paul's data, clearly makes you wonder why they're cutting PE. It seems like we ought to be putting in doubling the amounts of PE to help improve the academic scores rather than cutting physical education. Prioritization of varsity sports, the idea of hiring PE teachers secondarily to coaching certainly has an impact on that, when in reality the reverse should take place. We're hiring PE teachers, and oh, by the way, if you can coach, that's great. Additionally, resource and cost constraints, as you talk about some of the technology that's out there, is often given as an excuse why we can't change, but you know, there's options and opportunities on a low-end budget that certainly can allow for implementation of quality physical education. And also policymakers, decision makers, overload in the schools, and those type of things have also creeped into explanations as to why physical education is not being enhanced. Given the health trends in children and adolescents, and given the interest to make a change or a difference, there are numerous resources available out there. So as you look at this table right here, we've tried to summarize a number of resources that one can turn to for tools and resources, guides, action guide for working with schools, to recognition programs, the Healthier U.S. Schools Challenge, Blue Ribbon Award programs through IAFERD. There are a host of professional development opportunities with technology camps, certainly that we host, and other facilities and the trainings that they're doing. PE for Life workshops, conferences, and the like are certainly tools and resources that are available. There's a number of curricular models out there with the CATCH program, SPARK program, Planet Health, Youth Fit for Life, emerging practices, best practices with Walk Across Illinois, IAFERD programs. So there's a wide variety of resources that are available out there to help make a difference and enhance physical education. In closing, I share a quote that I often use when speaking at schools and interacting with teachers, and so I'll just read the quote for you. If each and every program would convey the message that to miss physical education is to damage one's health, it would gain measurable support from the community. Cholesterol level, body fat percentage, risk profiles, fitness profiles, and the like must be part of the student's portfolio. They should be as important as won-loss records, championships, and all-conference state honors. There has to be life after games and sport, and it has to be most important. A pop-up also on this slide is who the quote is from and the year. Probably the year is most important, not that I want to discredit or take away from Dr. Robert Kohler, a colleague of mine who's now retired, but that quote came in 1993, 20 years ago. And at times it's, I bite my tongue in the sense that, you know, why are we not moving this faster? Why is it taking 20 years to get to the point of still kind of talking about this and trying to push this forward? So 20 years later, here we are, and it's time to move PE forward and make a difference. with that, we thank you for your attendance and participation today. We wish you success in your efforts to enhance physical education and make a difference in our children.
Thank you, Dale. That was a great overview of some of the things that are going on in our community these days and some of the leadership that exists at the national, state, and local level. At this time, we have about 15 minutes for questions. And as you can see on the screen in front of you, you can use the raise your hand option if you'd like to ask a question, and then I will unmute you and you can ask your question. Alternately, you can put your questions into the chat feature on the bottom of the control panel. We have received one question, which is about whether there have been studies conducted exploring the relationship between emotional well-being and fitness. Paul, would you like to go ahead and say any comments on that?
Well, another question was if it was done locally. I'm not aware of any that have been done locally. I know that the CDC has at least 50 studies out there on the benefits of exercise in academic performance and socio-emotional well-being. I just know of anecdotal stories around the country of people who have started to incorporate some of our concepts about early morning PE or PE before academic classes that have seen results in discipline problems and attitudes of students in school.
Great, thank you. Dale, is there anything you'd like to add?
I think along that same line is just the comfort that it brings to students, that instead of it being a competition where you're on a team and you're trying to compete from an athletic or a sports skill standpoint, I think some of the things that schools are able to do with new physical education, new PE, has been beneficial, where you put kids in a cardio lab where instead of competing against each other, they're just working on a cardiovascular workout, increasing their heart rate, and it's not the threat of having an athlete, a good athlete, or a good an athletically inclined student in class dominating the class and making the lesser skilled person feel left out or punished as a result of that. So some of the things we're seeing in new PE have been really great equalizers for the kids who generally don't like movement, and I think that's been a real benefit.
Great, thank you. We have another question that's come in. You stated new PE and enhanced PE. Have you heard of HOPE, H-O-P-E, in reference to PE? If so, do you know its origin or other information about that? Paul, are you familiar with that?
I'm afraid that's a new one to me. I haven't heard of HOPE. Dale?
We all need it, though, HOPE.
I agree.
No, I haven't heard of that either. I guess I'd have to do some work in looking that up. But as we continue to come up with all these new names, I hope that it would be nice that the notion and the focus of all those are all moving in the same direction, which I assume they are. So.
Great. And Gina, if you have any information you'd like to share about that, you can do so via text. Donna Young, I see that you have a question. I've unmuted you.
Yes. We have a question. In our district, we still are under a waiver, and we're wondering how many more times a district can ask for a waiver.
Paul or Dale, I don't know if you're interested in answering that question. I know that it depends on the particular school and when they received their initial waiver. I believe they're allowed to request 2 waiver renewals. So you may want to look and see when the waiver was initially granted and what the possibility is for extension.
Thank you.
Do you have to wait for the waiver to go away, or are you running into issues with your administrative offices that they want to keep the waiver and the physical education can't put it in, or I don't know what your position is within the school? It seems like if the school wanted to put physical education back in, they could pull the waiver and go forward with it. Is that correct? Or?
In our situation, lack of space and funding for additional staff seems to be the preventative issue.
I think always it's important to fight waivers by being advocates ourselves. I truly believe that if we start to tell administrators about the brain science and how it works and how students are affected by the value of exercise and how exercise itself prepares the students for learning, that we'll be able to eliminate some of these waivers. If they start talking about lack of money, they certainly don't have a lack of money when it comes to putting in a computer program that will enhance learning. So we just need to advocate for ourselves as physical education teachers to say we also have that added benefit to the learning process as well.
Thank you.
Thank you. Please remember you can hit the raise your hand button if you'd like to ask a question, and I will unmute you. We do have a question that's come in about how Let's Move in School could help advance enhanced physical education.
I'll answer that, and I've said this before. Let's Move in School can enhance that, but it doesn't take the place of quality daily PE. And we have to make sure that people understand that. I think Let's Move in School, we have to tell the academic teachers it's important to get the students up and active in their classrooms. We in the Naperville school systems like to try and take brain breaks at the high school level after about 20 minutes of class time because we know that students normally can't sit still any longer. Again, it's all based on brain science and neurochemistry, and so again, Let's Move in Schools can only enhance what we're doing, but it doesn't take the place, I don't believe, of a quality daily PE program.
Thank you, Paul. I do want to point out that somebody has provided some background information on the Health Opportunities Through Physical Education HOPE program in the comment box, so you can refer to that if you'd like to know a bit more. And Gina Parker has also encouraged folks who would like to know more about waivers and have some assistance with that to contact IAFERD. We have a question specifically about the Naperville program. How does Naperville roster students for PE to match students' academic needs? Do they have 0 hour before and after school, or directly before the class subject each student needs?
We roster the students looking at their performance coming in. We look at least 3 markers, statewide tests and nationwide tests. When we determine that they are below reading level or below grade level in math, then we target them for our academic reading class or our introduction to algebra class. Then we try and pair the LRPE program a period or 2 before they enter those. So we have the LRPE classes throughout the day. We're up to now 5 or 6, I believe, throughout the day, and we just try and pair the academic classes in close conjunction with those LRPE classes.
Thank you, Paul. We have 2 comments that have come in about the importance of sharing this information with local school board members, local school council members, and administrators. And somebody noted that this is included actually as one of the strategies in the Illinois Enhanced PE strategic plan. I will point out that, as Dr. Cook mentioned in his opening remarks, the new Senate Bill 3374 created Enhanced PE Task Force is charged with promoting Enhanced PE, and there are the Association of School Boards and school administrators and school officials and a lot of those groups that are the decision makers and that have the opportunity to provide a lot of leadership at the local level on this issue are engaged in that task force and will be working through some of the opportunities for promoting this throughout the state.
Colby, can I make a comment?
Sure.
To all you PE teachers out there, you need to be your own best advocates. You know, I've tried to spend lots of time talking to legislators and administrators over the years about this. I think what we need to do is we need to talk to the parents. There is no board member who wants to argue with a mother who wants what's best for their child. And so we need to enlist the aid of our parents to help us get what we consider a quality PE program in our schools that will enhance learning.
And that's an excellent point, Paul. And actually, there was a question that came in from one of the participants asking about how to engage parents, because sometimes they remember the old PE, with blowing the whistle and throwing out the ball, and they wanted to know the best way to get new methods out to parents as a whole. I did notice at the beginning of this webinar, when we did a poll for who's on the call, there were a number of public health professionals on the call. Many of them often work with community-based coalitions that engage various agencies in the community and often work with schools on a number of topics. And that may be something to look for in your community, whether there's a community-based organization that's interested in this issue or supporting this issue, and to look and see through the We Choose Health funding opportunity that Dr. Garate mentioned earlier in the call, whether there is a group funded within your community to work on coordinated school health, which includes physical education as a component.
In response to some of the questions that are listed there, and echoing what Paul has indicated, my first interaction with Paul was after we got a decent-sized research grant, and we were working with one of the area schools, and we decided to charter a bus and take physical education teachers up into Naperville in style from Bloomington Normal, and brought them, as we were planning this, talked with Paul, and Paul quickly said to us, he said, don't just bring the people who are sold on quality physical education, bring your administrators, bring your school board members, bring your athletic directors, bring the naysayers up, and said, basically, Paul said in a nutshell, if you bring them up and if we can't convince them, you don't have a chance of doing that. That doesn't mean you still shouldn't work towards that, but I think there are a number of advocates that if you need people to come visit your school, sit down with the school board members, sit down with parents, we certainly can do that. Second point on that, just speaking from my own personal experience as a parent, I think teachers need to look at how you're delivering your program and the perception of what you're conveying about your program at your parent-teacher conferences or whatever the case is. I remember vividly, my son was in 6th grade, we went to the middle school and met with the academic teachers, and of course they got a half hour, 45 minutes to talk to us, and then we met with the ancillary academic areas, the art teacher and the band and the PE teacher, and in that 5-minute window you had as a teacher to sell your program, and the art teacher came in a matter of 2 minutes she had the room captivated, and you felt as a parent great because your kid was in an art class. PE teacher followed that, walked in, banged on the podium, and said, your child has to have a uniform, your child has to dress every day, and you have to be on time. And as a parent sitting there, I felt, well, I hope you're doing more in physical education than that. I don't want to end there because I don't know if people in those schools happen to be listening, but what we did is we sat down with the teachers and said, how are you conveying your program and how are you selling your program? And there's nothing, as Paul said, more powerful than you pull up those CDC slides showing the changes in obesity trends in America and show the diabetes changes in America, and you see very quickly that parents gain support, just exactly what Paul said. Moms, dads care about the health of their kids, and if you can show you're going to have an impact on that, you'll get parent support quickly. In a matter of 1 year, the school we were working with turned that around, and you got the parents sitting in the crowd saying, great, my kid gets to be in PE, versus great, you've got PE, I need to buy a uniform. So I think there's things you can do. You got to kind of take a step back, look at what you're doing, how you're doing what you're doing, and if you need support, I speak for Paul, I guess we're more than happy to do what we can to help out.
Excellent. Thank you, Dale. And in respect of folks' time, we're going to go ahead and wrap up. There are a couple comments in the chat block that you can look at about some resources that IEFRD has and other groups for supporting teachers as they want to make presentations to school boards or parent groups. The continuing professional development units, as we mentioned at the beginning of this webinar, will be available for those who participated in the duration of the webinar. You can find them in the materials section of your control panel on the right-hand side. Please submit those via email or fax to the contact information provided on the screen. It's also provided in the PDF included in the materials section. With that, I want to sincerely thank all of our presenters, Dale Brown and Paul Zintarski, for the time and energy you put into preparing this presentation and the amount of work that you've put into raising the profile of PE and really promoting this issue at a larger level. As well as our two opening speakers, Dr. Cook and Dr. Karate from the State Board of Education and the Department of Public Health, who have provided some excellent state-level leadership on this issue. With that, we're going to end this webinar, and thank you to all the participants who have stayed for the duration of this session.